Hey folks, this is Dr. Gerstmar from Aspire Natural Health. I wanted to talk today about a big thing, the two different types of medicine that exist today. So when I say that, most people think, oh, he's going to talk about the conventional medical system and by whatever word you want to use it, the alternative medical system. That's actually not what I'm going to talk about today. I don't think those two systems are as far apart in their basics as everybody thinks they are. So what is, and there's a few pieces, right? But what's the single biggest difference between the conventional and an alternative medicine? And it's this, it's what therapies are being used, right? So when we talk about the conventional system, we're talking about drugs, we're talking about surgery for the most part, physical therapy, a few other odds and ends, but basically drugs and surgery, right? When we talk about alternative medicine, what therapies are being used, right? Most commonly you're thinking of diet changes, exercise maybe, herbal medicines, nutrients, supplements, that kind of thing, right? So generally we're talking about one set of tools, surgery and drugs, and another set of tools, diet, lifestyle, herbal medicines, supplements, that kind of thing. There'll be a few odds and ends, but basically that. And the way I personally look at it is all of those therapies are simply tools in a toolbox, right? And so we have craftsmen, people who are exceedingly good with a specific tool. And that's great. That's great. We need people who are exceptionally skilled at those tools. But the reality is, most of what we're facing, we need a craftsman who can pick and choose among tools. So the way I look at it, the way I think all doctors should look at it is, you have an issue, what tool is most appropriate, what is going to get you the best results, the most quickly, the most permanently, with the least amount of side effects, right? And sometimes the answer, often, the answer is, well, dietary changes, that kind of thing. And sometimes the answer is, nope, drugs or surgery are your best choice. And we end up with a false dichotomy, a false either or, when we say, well, it's either drugs or surgery, or it's, alternative therapies. So what is, if the two different medical systems are not the conventional system and the alternative system, what are the two different therapies? And it's simply put, acute crisis care versus chronic disease management or root cause resolution. We're going to call that second thing a couple of different things. But let's lay this out. We talk about the conventional medical system. Because of my profession, we talk a lot of the faults of that system. But the reality is there are many bright points. There are many things that they do right? Most MDs are extremely intelligent, very dedicated, very caring people who work in an absolutely crappy system, that often beats the intelligence and the caring right out of those people. Who doesn't let them do the jobs that they need to do. But let's back up for a second. So we have this incredibly bright, incredibly dedicated, incredibly skilled set of people, who work in a system that is designed for crisis management. I've heard it said another way, conventional medicine, allopathic medicine, whatever name you'd like to give it, came out of battlefield medicine. What do they do well? Fundamentally, they do several things well. They do crisis care. That is, look, if you have a broken bone, you're in a car accident, you have a heart attack, or your health is in such a precarious place that you truly need to go to a hospital, nobody does that crisis care as well as the conventional system does it. Certainly do not go to an alternative provider, myself or anyone else, if you're suffering from a heart attack, you have bones sticking outside of your skin, you're bleeding profusely from something, we are absolutely the wrong providers to come to. Our skill sets, the therapies that we use are not well suited, That is where the conventional system shines, So treating crisis, and then with the invention of antibiotics, it's really the treating of acute, that is, serious infectious diseases. Those are the two areas that conventional medicine absolutely shines in. So what has been the biggest health issue for human beings up until the past 100 years or so has been emergencies, So in the course of your job or your day, you got injured or hurt, an animal attacked you, or infections. right? Whether that's, one of the epidemics or, cuts and scratches or something that got infected. By and away, those were the two things that most significantly impacted our ancestors in the past. And so conventional medicine, as we think of it, rose up, developed, evolved primarily to deal with those two things. But what's happened now, right, for those of us who live in modern Western cultures, right, we barely deal with traumas and infection, those acute infections anymore, right? Those are usually not our big problems. Instead, chronic degenerative diseases, things like heart disease, not heart attacks, but heart disease, diabetes, right? A lot of these other, obesity, overweight, these are the issues that are the prime problems. Also, we can throw in autoimmune diseases, digestive diseases, right? Mood problems. Basically, 90+% of the issues that people go to doctors for in cultures like ours are for these chronic degenerative diseases. The issue? The skill set, the tools that work well for emergency crisis management do not work well for treating chronic disease. And that's the biggest problem, is we have a crisis medicine model that is being forced to do double duty and take care of chronic degenerative disease. How well does it work? Look around you, right? Obesity rates climbing, heart disease rates climbing, cancer climbing, things like autism, autoimmunity, all sorts of other chronic degenerative diseases are on the rise, right? So we're not doing a good job at combating those, and it's not cost effective either, right? We're spending far and away more money than any other country trying to make this crisis management model fit in to a chronic disease management system, right? So we have that system of medicine, and then we have basically the system of medicine that I do. So again, if you have a crisis, do not call us, do not come to see us, go to the hospital, go to the emergency room, get that taken care of, right? But if you have a chronic degenerative disease and you go into the crisis model of medicine, the best thing that they are going to be able to do is manage your disease. And often they're not going to even do a very good job at that. So you will hear endocrinologists and this word kills me here trying to say this, diabetologists, right? Doctors who take care of people with diabetes. They will say things like, once you have diabetes, you will always have diabetes. It will get worse over time. You will need to take more medications. You may need to have more surgeries, more tests, all of these things, right? You are on an escalator now that only goes in one direction, and that's down. Right? Again, because we're trying to apply crisis medicine to chronic disease management. What do we say? You have diabetes. It is absolutely, again, we're pretty much talking about type 2 diabetes here. So anyone with type 1 diabetes, I apologize. I know it irritates you when people say diabetes, and really they're talking about the type 2 diabetes. The reality is that's what the vast majority of people with diabetes have, and so they get the limelight, the lion's share of the attention, right? But type 2 diabetes, the vast majority of people with type 2 diabetes with the correct treatment can either become minimally diabetic or completely non-diabetic, right? All the side effects, all the increasing, hamster wheel of drugs and everything else, for most people, they can absolutely be avoided with correct care. But it is not using crisis medicine, right? It's using care designed for chronic disease. And that means approaching it in a different way and using different skill sets, right? So if you're lying there bleeding because someone has shot you, does the doctor really need to know your name or what's going on for you? Maybe your social family life, right? Your job situation, what foods you like to eat, what foods you don't like to eat, your personal preferences, any of these other things? No, they absolutely don't. Those don't matter. The only thing that matters is plugging those holes in your chest so you don't die, right? But how about when let's continue with diabetes. How about when we're talking about the treatment of diabetes? Do you need to have a relationship with your doctor? I say absolutely. Does your doctor need to understand what works for you and what doesn't? Absolutely. Do they need to know about your hopes, your dreams, your challenges, your concerns, right? Your family situation. That is, do you have supportive family and friends who are helping you make these diet and lifestyle changes? Or do you have hostile family and friends who are opposing you, right? How do you like to take things? Do you prefer pills? Do you prefer liquids or powders? Because the reality is there are some things that you're going to need to take. How about exercise? What do you like to do for exercise? What do you not like to do for exercise? Do you have aches or pains or other disabilities that are going to make certain things more possible or less possible? All of these things need to enter into the equation, right? When we are talking about chronic disease management, it is so much more than simply what is the name of the disease that you have and what, therapy do I need to pull out of my toolbox right now to try and stabilize you. Because chronic disease management, while stabilization is important, right? We follow a 4-step process, and the first step is stabilization, right? If you feel terrible, right? If you have thyroid problems and right now you're super fatigued, you can barely get up out of bed and get going in your day-to-day life, what's the first thing that needs to be addressed? It's that thyroid issue, right? We need to give you some energy, get you functional again, so that then we can turn around and do step 2, which is evaluation and testing, right? Which is much more comprehensive, much more individualized than in the crisis management system. Because again, it doesn't really, your individuality in a crisis, it plays very little bearing on your treatment. Your individuality, both biochemically, right, but also mentally, emotionally, socially, spiritually, is massive in chronic disease care, right? Step 2 is that testing and evaluation. Then step 3 is that treatment. Then step 4 is about long-term management, right? So, is it possible for many, many people with diabetes to come in, to have their diabetes essentially in complete remission, not taking any medications, and having good blood sugar control? It is possible. Will everyone get there? No. But can virtually everyone reduce the amount of meds they have and alter the course? So instead of just going down over time, they're either actually straight, right, not declining, or perhaps slowly but steadily improving for people. I believe basically everyone can have those results. Now, in terms of management, does that mean you can go back then and eat whatever you want, not get any exercise, not attend to all these things, and never have diabetes again? No, it does not. That is why instead of saying we are curing your diabetes, we say we are putting your diabetes into remission. Because as long as you're following sensible and reasonable diet and lifestyle guidelines, as long as you're taking care of these other issues, basically your blood sugars are good, your diabetes does not bother you. But if you suddenly decide, oh, the heck with it, I'm going to eat a dozen donuts and I'm not going to do anything and all these things, are you going to have problems? Yes, you are. Right? So let's step back again. We've been talking about the 2 types of medicine. They are not conventional and alternative. They are crisis management versus chronic disease care. Right? So at best, when you take that crisis management and you try and push it into the treatment of chronic disease, you end up with chronic disease management, where the best you can hope for is a managing of your symptoms and your disease. Instead, we really want to practice root cause resolution, getting to the root cause whenever it's possible. And let me be candid with you. Sometimes we find it, sometimes we treat it, sometimes we can't find it, or we don't know enough, we don't have good enough tests, or we're just plain out missing something. We don't always get to the root cause, but we try. Right? Because again, if we can deal with what's causing these symptoms in the first place, then there's no need to manage. There's every hope that we can resolve, right? So we try for root cause resolution, and then we start with, a hierarchy of diet and lifestyle at the bottom, progressing upwards, 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 until we do get to surgery and drugs at the top. But we have a lot of therapies we can go in between. And again, it's not necessarily about the therapies per se, it's about the mindset and approach that we're taking when we're dealing with this. So 2 types of medicine. I hope I've made it clear here that we have 2 very different situations. We have crises, and In a crisis, you should use the tools, the techniques, the tests of the conventional medical system, because that is what they excel at. Trying to take the alternative tools and techniques and mindset and use them to treat acute crisis is a recipe for disaster, right? A lot of people will die, will be hurt, and will get inadequate care. But we flip that around now. We say that most people, most of the time, are not dealing with crises, right? They're dealing with chronic degenerative diseases. And similarly, taking that system and trying to use it to treat chronic degenerative disease means a lot of people die, a lot of people are hurt, way too much money is spent, and people don't get effective treatment, right? So it's important, I hope you guys will take away from this, that simply put, we have two very different situations and we have two different styles of medicine. Use one for one and one for the other, and don't expect that either one is going to effectively treat the other. All right, having said that, please check us out, aspirenaturalhealth.com and facebook.com/aspirenaturalhealth. We are definitely not acute crisis care doctors here. We are people who deal with chronic degenerative diseases by using a proven system that focuses on root cause resolution, that tries to resolve and cure whenever it's possible, and seeks to manage when it's not through the use of the lowest intervention, starting with diet and lifestyle. We specialize in treating autoimmune diseases, gut problems, and those hard to treat cases that have sent you scurrying from doctor to doctor without any help. If we can be of assistance, please contact us. Until we talk again, take care.